Hello, it's the Streetwise Chemist. We're back again in the winter.
Yes, I'm Jamie. I'm back again from the last videos.
Right, so what are we on about today?
Well, because it's the winter, it's cold outside, so I thought we'd do coughs and colds, sore throats,
Coughs and colds,
anything
yes.
like that.
Yeah, that's fine. Yeah. So, we have many people suffering from colds and coughs, and they can even get the flu as well. So, really, many people come in and they don't know what to buy, isn't it? It's very confusing what they read on the boxes, what they hear on the adverts, and then they come into the pharmacy or they walk into a supermarket and they want to pick something, and it's so difficult because there's so many different
There's a
ones.
lot of options.
Yeah. So what we're trying to do today is go through what we have in pharmacies and some of the things that you can buy over the counter as well, and help you decipher and how do you make the choices. What are we looking for? What ingredients are we looking for? Because I tell you, if we go by what just they say on the boxes, it can be really misleading. I mean, we can start with chesty cough and you think, what does that really mean? You've worked in the pharmacy for 9 years,
Coming to 10 this year.
tell me about it. So
So I often feel people come in and it feels like I'm interviewing them. Is it a chesty or is it a dry? And they're looking at me like, what does that mean? So what is the difference between a chesty cough and a dry cough?
So generally, I don't like to use the word chesty because it's very confusing. In what way is it chesty? Is it because it's got phlegm? Is it because people just are coughing so much and they're having to use up a lot of energy? So it's very difficult to understand. So in the pharmacy, when you come in, what we're trying to establish is whether the cough is productive, that is it got sputum, has it got phlegm, is this catarrh, is it something coming out of there, or is it just sort of dry, non-productive? So those are the words that we like to use. We like to say, is it with mucus or without mucus? I think those are the right words to use. Because this chesty business, as you so know when we describe, you think, what does that mean? If you look at the ingredients, and it just doesn't make sense. Okay, so we like to know, is your cough with phlegm or without phlegm? And as we know, most coughs anyway start because there's a viral infection that's affecting your membranes, usually nasal membranes. So you've got a runny nose, you've got nasal congestion, and then it goes down to the chest. If you're starting with the chest directly without any nasal symptoms, we tend to worry about that. Because that could be pneumonia, or if you've got breathlessness, and sometimes with pneumonia you don't even have a cough and they're just breathlessness. And we want to be aware of that, to say, right, these are danger signs. You want to go straight to your doctors. I mean, you can come to us, we can decipher that for you, we can sort of rule things out. But if it's coming and you've not had any nasal, because usually these coughs are starting nasally. It can start at the same time, but if you don't have any nasal connection with the cough, it's just a cough, then we get worried. And again, one of the things that we want to say straight away, if you're losing weight, if your cough is going for more than 3 weeks, you need to be seeing a doctor. All right. So what do you want to start with?
Well, we've spoken about coughs then. And then we ask, is it productive, non-productive? But why do we do that?
Good, yes, because of the ingredients, right? So I'll pick one. I think let's start with this notorious one. I'll start with this one. So this is benylin chesty cough. And this is why I don't like this chesty business. What does that mean? So you'd think, with most people, they think that's a cough with phlegm. It's cough with mucus. Now, if you look at the ingredients, it's got diphenhydramine. Now, you've been in pharmacy for 9 years. Can I put you on the spot? What does diphenhydramine do?
Diphenhydramine is an old school antihistamine.
Very good.
It's now used in things to help you sleep.
Yes.
But
like Nitol.
Like Nitol, yes.
Yes.
But from what I understand about coughs, it can help to dry any secretions up.
Good. Yes, because it's got those antimuscarinic side effects. So it's an antihistamine, and histamine, if we go back, so I like to go into the science, and I don't think this is really hard science for anyone on the street to understand. So histamine is what we produce. Histamine is being produced to fight as a response to the virus. So there's a foreign body that's coming to your body. the histamine is produced. What does histamine do? Histamine goes to the blood vessels, dilates them, and they leak out the mucus. Yeah. So what you're trying to say is, if we block the effect of histamine on our blood vessels, then we're not having this mucus secretion. We're not having the itch, because the histamine is the one that causes the sensory sensitivity. So we're trying to take away the sensitivity, so you're not coughing as a result. And as well, because diphenhydramine acts on your brain, it penetrates the brain. So any histamine that penetrate the brain barrier will be sedative. So it goes and suppresses the cough on the cough center. So now the cough reflex is suppressed. So what are we saying? We're saying chesty cough, but what do we have in there? We've got an ingredient that suppresses the cough with an ingredient that stops secretions. Anything that stops secretions has the potential to thicken them, because they're not moving as much. So if it's chesty in the sense that it's got mucus, we're actually doing the opposite.
Because if it's chesty, then you think you want to get it up and out.
Oh yeah, you think it's but we're using a cough suppressant. We're using something that dries up secretions, so the mucus is going to stay in there. And what's next if mucus is kept inside?
Chest infection.
We can get chest infection. So it's a bad one for me to say, why do you call it chesty? But they will argue maybe to say, oh, chesty means without phlegm, without mucus. I don't know. So that's why from the very first time we're discussing this, I'm thinking, the language is not very good. So you don't want that really. So if you're going to use this, fine, it's good. It's good for a cough which is non-productive. It's good for a cough with nasal secretions. So you've got a runny nose, it will dry it up. You've got sneezing, it will do the job. You're not sleeping well, it will do the job. So it's very good for that. But it should be non-productive cough, not mucus cough.
So really we need to be going for the ingredients, not the language that's written on
Not the language, but how is the person on the street able to do that? The ant. This is why it is important to walk into a pharmacy and then we can guide you. All right. Anything else?
Watch the Streetwise Kemist.
Or watch the channel.
Okay, so that's that one.
That's one.
Chesty cough. Let's
Shall
go
we?
for
Because this is related. So this is again benylin, but this one says dry coughs. So this one is correctly prescribed, if you want. It's correctly marketed, because it does have diphenhydramine, just like that one. So it will dry up secretions, it will suppress the cough, it will give you a good night's sleep. It will stop the sneezing. But it's got something as well in there. It's got dextromethorphan. Tell me about dextromethorphan. You've been in the pharmacy for 9 years.
I have. That helps to suppress the cough.
So dextromethorphan is like a panel-beaten codeine. So it's not an opiate. It won't really get you the high that you can get with codeine. But it suppresses the cough in the brain.
So in the same way that morphine sometimes helps to reduce the breathing rate, something there.
We didn't say that. She's also a trained nurse, so she knows something. But remember, codeine, you spoke about morphine. The codeine, the active ingredient for the active moiety, if you want, for codeine is actually morphine. So codeine is a precursor of morphine. Once you take it in, when it digested in your body, it will work as morphine. We'll cover this when we do painkillers at some point. But the good thing is, this is codeine-like, so it suppresses your cough. So we actually have two ingredients in this one, which both suppress the cough, but in a different way. So this is a direct cough suppressant, which is like codeine-like, dextromethorphan. We have diphenhydramine, which we've already discussed. And which will cover the reactive symptoms, like the sneezing, the runny nose, the cough. It will suppress the irritation in the throat, because it's an antihistamine, isn't it? Anti-allergy. And of course, we got a bit of levomenthol. Levomenthol is an ingredient that we'll find in other things. So levomenthol basically is a counter-irritant or a demulcent. So we're trying to, encourage moisture around the throat, so that we hydrate the vocal cords. And because it's an irritant, it will increase a bit of salivation and coat the larynx, so that cough reflex is suppressed that way. So it's sort of a demulcent. I mean, at the doses that we put them in, we don't know whether it actually works as such, but really that's a very good cough mixture for people with non-productive cough.
Okay.
Yeah? Okay. We don't want this if you've got mucus for the same reasons. We don't want to suppress the cough reflex.
Yeah.
We want to encourage the mucus to come out, which brings us to something that causes that. An expectorant. So which one are you going to pick? Yeah.
Any one of these.
Good. Yeah, any one of these two. Yes. Yeah. So what do we have in this one? You tell me.
We have guaifenesin.
Guaifenesin. Yes. And guaifenesin is again an irritant. It's actually, if you take it in high doses, it's in like an emetic. It will cause you nausea and vomiting, and anything that causes nausea and vomiting, like ipecacuanha, which we don't quite use in cough mixers now. I can't remember any cough mixture with ipecac. Well,
no.
it's a herb, Okay. Just like this one, it's plant origin as well. Yes. So these will loosen phlegm. So they're irritants. So they increase salivation. They will encourage the mucus to actually more mucus. So it's an irritant.
Yeah.
So it's like more mucus is actually produced.
That's always one thing that I was always confused about when I first started.
Yes.
Because I'm thinking, if you've got a cough, why do I want to encourage myself to cough?
Yeah, but this one, we're loosening it, yes. Because remember, we've said with antihistamines, because they're suppressing the mucus secretion, it could actually thicken.
Yes.
Whereas these ones, because they're irritating, the mucus breaks up, so it's loose, and we can then cough it out, which is what you want to do. So that's what you get in guaifenesin, and that's a good one here. Robitussin chesty. Now, this is why I say this chesty business. They said chesty, and they have an expectorant, which encourages. This one said chesty, and they've got a suppressant. So don't listen to what the manufacturer is, the marketing wording from the manufacturer. It was very confusing. Stupid. I don't think it should be allowed. There must be someone there, some consumer counsel, to say, make it easier for people to know what they're buying. You can't call this chesty and that one chesty, but they're doing the opposite. It doesn't make sense.
The language isn't very
It's not good.
clear.
Right. So there's another, yes, but this is the same thing. So this here, this is benylin mucus max. Again, it contains the same guaifenesin. So same story, encourages the loosening of the mucus so that you can drive it out. They've added as well a bit of menthol. We've already explained how menthol works. It's a counter irritant. Yes.
Okay.
Just like you would use menthol crystals, eucalyptus, if you go the good traditional way of, inhalation, steaming yourself. Yes, my cruel grandmother used to do that to us. Get in there, press you down. And they use very hot water as well. It presses you down in there, breathe it in. And then, all the mucus is coming out. You're huffing and puffing. And that's what they're doing, but in a gentle way, not in my grandmother's way. Okay? And last covers the expectorants. There's another expectorant that they use, citric acid or sodium citrate. So simple linctus, citric acid. So citric acid, again, is a bit of a counter irritant. So it will increase salivation. It will coat the larynx as well, so that the irritation, that you're getting once you're sensitive from the virus that triggers the cough reflex is mitigated. And as well, it can loosen the phlegm.
Right.
Yeah, because it's an irritant. So I said anything that's sort of irritant that causes salivation will cause secretion, increased secretion. Increased secretion means loosening of the phlegm.
Yeah.
And you break it out that way. Not very effective, these things. If you ask, this is why the NHS doesn't prescribe them. There's an argument to say these things actually at the doses that we give are not as effective. But tell that to somebody who's been coughing the whole week and say, oh, this is not going to work. There's no way. People like their cough mixtures. I don't take any myself.
No, you
I usually take the sweets.
Aren't you, as well?
Yes, steam inhalation I do, and I use the sweets, menthol, eucalyptus, again, as counter irritants. Yeah, but the one that I used to take, which is no longer on the market now, is G's linctus.
Oh, okay.
Yes, G's linctus has all these herbs. It had a bit of morphine as well. Yeah. So it was another one which it had expectorating ingredients, things that loosen phlegm, and it had things that could suppress the cough as well. So whatever, between the two of them,
something was working.
Something was working, so I used to like that. And of course, who doesn't like morphine? I'm supposed to be a chemist, so I didn't say that. Right.
Safe use only.
Safe use only, yes, yeah. Okay, so we've covered the expectorants. Now we want things maybe that are meant to deal with the sinus congestion, with the sneezing, runny nose. We've touched upon it already.
Before
but there
we
are some
move to
things
that
you
though,
think, yeah.
there's one cough mixture that we have kind of touched on,
Mm-hmm.
but we'll go with this one.
Yeah, okay.
Because this is strictly for the dry cough.
Yes, non-productive cough.
Yes.
Yeah.
But it's slightly different in the way that this one
works.
was.
Yes, because this one is a combination, but
Yes.
this still has codeine-like thing, which is dextromethorphan.
Yeah.
Yeah. So again, it's a cough suppressant, but it's standing by itself.
By itself.
Yeah. So if I was given a chance, if you don't have any nasal symptoms, I would go for that.
Yeah.
But if you've got a cough which is non-productive with nasal, then I'll go with that.
Yes.
Because not only does it have the direct cough suppressant that suppresses on the medulla, on the in the cough reflex, it also has an antihistamine. So yes, that's another dry cough thing that you can use. In fact, before we go there, do we not have anything with because it's not only in liquid, isn't it? You can have the cough suppressants in tablet form as well. Yes, yeah, like this one here. So you got Night Nurse. Night Nurse has promethazine. You tell me, I don't want to be just the one talking.
So you might already be able to guess by the endings of certain drugs. We've touched earlier on an antihistamine called diphenhydramine. This is promethazine. Promethazine is also an antihistamine.
Yeah,
It's
of
got
an
many
old
uses
kind.
now.
Yes, an old kind, which means they penetrate the brain much easily
Okay.
compared to your cetirizines, your loratadines, which are non-drowsy.
Yeah.
This one is definitely drowsy,
Yeah.
and more drowsy than diphenhydramine, more drowsy than chlorpheniramine,
Yeah.
which is your Piriton. Yeah. So again, we're using it for the same effect. Anything that causes drowsiness. This is why the old man will take a shot of whiskey for their cough. Anything that causes drowsiness will suppress your cough reflex.
Yes.
Okay. So we've got promethazine there as a cough suppressant, as an antihistamine, anti-allergy. So to stop the allergic reactions that we do, sneezing, runny nose, irritation in the throat, that will suppress that. You got your paracetamol if you needed it. I never take painkillers, but for those
Good head cold.
head cold,
temperature,
fine, yeah, and reduction of temperature especially, yes, yeah. And you have your dextromethorphan, which we now know is our codeine-like cough suppressant. So again, that's a loaded one.
Yes.
I like this one because if you're really suffering and you're coughing at night, that will give you a good night's sleep.
Yeah.
Yeah.
And then I can see it comes in the liquid form as well.
Comes in a liquid form, yes. And of course, we've got a problem, unfortunately, because of the drowsiness there, a problem, people misusing it and a bit of dependency on it.
Okay.
So we really monitor if someone is coming in week upon week buying this, we'll say, it's very annoying to people, isn't it, in pharmacies, when you come in and we have to ask all these questions. Well, we have to make sure that we're doing the right thing.
Yeah.
Are you not taking any other medicines? All these that I've spoken about, for instance, the older antihistamines, you don't want to give that with someone with narrow angle glaucoma. So generally we just say if you've got any problems with pressures in the eyes, if you high pressure in the eye, you don't want to take these.
Yes.
Okay? Fine with blood pressure medicines, because anything that is sedative tends to slow down everything else.
Okay.
So that should be fine. But generally we say avoid that in people with glaucoma. Bladder problems, yes, but at the doses that we have, they're not really going to cause any bladder issues. Constipation is not really going to be that bad. So we're fine with that. There is one antidepressant, Mau Eyes, they're rarely prescribed. So if you mention them, we will know them. But your normal sertralines and so forth, there is a chance of something called serotonin syndrome, but it's not going to happen at the doses that we give. So we're not worried about that with these. So generally, almost everyone, diabetes, yes, most of these contain sugar.
That's another thing. A lot of people with diabetes will come in
Yes.
and they know themselves, they'll ask for this one.
Yeah, Robitussin. So that one is a sugar-free.
Yeah.
But remember, these days with the modern treatments that we have, it's not like the old times when you say diabetes, you don't take any sugar at all. Nah. If you have your cough, you want a cough mixer, yes, it's got a bit of sugar, but if your diabetes is well controlled, we can still use that.
Yeah.
Okay? Right. Did we miss anything? Glycerol, there is not much evidence. Again, glycerol is supposed to be a demulcent. So it's supposed to coat the lining and then soothe the throat. Yeah. So that's how they're supposed to work. So anything with glycerin. In fact, this is all that you have now in children's cough mixtures.
Yes.
Because they've taken out all the major active ingredients because they thought they pose more harm, more danger than the benefits really.
Yeah.
Okay. So is this the next one?
I've got two. Well, these ones, yes. Next few.
Yeah.
For
so
coughs.
you want these ones for the coughs? Yeah.
Please.
Fine. This one here again. This one is a traditional one. It's called squill. Squill used to be in the cheese lincters as well.
Oh yeah, that's
Yes. And capsicum. So these are irritants. Okay. Again, these are irritants. So it will be for a mucus cough.
Mucus.
Yes. Because they're irritants. They're meant to loosen the phlegm. So buttercups is not for a non-productive cough, for a productive cough because it's got irritants in there, herbal irritants. Okay. Bronchostop, again, sort of something. I don't like this one. It claims to treat every
kind of
cough. Any cough mixer that claims to do everything can't do so. Why? Because we either want something that encourages mucus to be loose, or something that suppresses the cough so that we preserve the energy and we're not suffering.
Yeah.
In fact, something that comes to mind, if you really had bad mucus and profuse mucus, especially smokers, people maybe with COPD, there is a proper mucolytic that proper breaks mucus, and that's carbocysteine. That's available on prescription. So really, if that mucus were really horrendous, the doctor might prescribe something called carbocysteine or other cysteines of the same nature.
I know when I was on holiday in a different country, they had something and I could see the cysteine and I had a cold and I knew it must be something to do with the
with that.
Yeah.
Yes. So it's in the same family where it's a proper expectorant, a mucolytic.
Yes.
It actually breaks up the mucus.
But there's nothing like that over the counter.
There's nothing like that over the counter. No. Yeah. Another cough mixer here is Actifed Dry Coughs. This is a good one, I would say, because it's got dextromethorphan, cough suppressant, good, codeine-like, which you have said. Triprolidine. Now, triprolidine is an antihistamine, again, of the older generation. So it will cause a bit of drowsiness, but it will work as an anti-allergy again. So suppress the cough reflex, the irritation, the runny nose, and it's got pseudoephedrine as well. Okay? Now, pseudoephedrine, shall I put you on the spot?
You can.
Try.
Okay. It comes from something like adrenaline, so it can help to perk you up a little bit.
You've been taught by the right person. Whoa! Yes.
I need to. For 9 years, I need to have learnt something.
Something. And you caught up. Yes. So pseudoephedrine is adrenaline-like. So think of it as adrenaline. What does adrenaline do? It prepares you for a fight or to run away. Yeah. So it will raise the heart, not as too bad, but it will raise the heart. And already, once you say that, we know we cannot use it in people with high blood pressure. People with thyroxine is not well controlled, is too high. People with anxiety, people on antidepressants of some kind, some of them on a lower dose, yes, because it gets you up and running. But that's why they put it in there as well, because it makes you feel better.
When you've got a cold,
you're down with the cold. Yes. But mainly why they put it in there, because it's a vasoconstrictor. So it constricts the blood vessels in the nasal cavities. Blood vessels, we've said, they've dilated because there's histamine produced. They've dilated, they're leaking mucus. There's edema there. So what we're trying to do is to shrink those blood vessels so that they're not leaking this mucus. There's no flooding around there. So they're used as decongestants. That's why we call them decongestants. So it acts directly, and it encourages as well the release of adrenaline. So pseudoephedrine. Pseudoephedrine, we limit the number of tablets that you can buy, isn't it? Over the counter, only 12. Why?
Well, I always have to advise short-term use only.
Yes, short-term use only. But another reason why, a naughty reason why pseudoephedrine, manufacture of something. Speed.
Okay.
Speed. So it's very close to amphetamines. And what do the amphetamines do? Again, they get you up and running.
Now you've said it, I can tell the endings of certain drugs.
Yes, amphetamine, yes. Because in as well, So pseudoephedrine is a few steps from becoming amphetamine. This is why in sports they're banned.
Right.
You know, sportsmen are not supposed to take this. They'll say, "Oh, I was taking it because of my congestion," but they are taking the pseudoephedrine so that they can run all over the place and not rest.
Who knew?
Or whatever, and not tire. Yes. So pseudoephedrine is that's why it's there. It's constricting your blood vessels, tends to raise your heart a bit.
Yeah.
As well, and can cause tremors at high doses.
Right.
And so forth. And again, we don't want it with people with glaucoma because it can also increase ocular pressure. Yeah. And what else? But we're basically giving it to so that the nasal passages are open. Remember, prepares you to run or fight, which means it opens up airways. That's very important effect. Yeah, it opens up airways, but not really at the doses that we give. But we know one of the effects, in theory, is it opens up your airways so you breathe better. Okay. That's pseudoephedrine. The one thing that is related to pseudoephedrine is phenylephrine. So phenylephrine is the version that you can buy over the counter. Yes. Just like you have in Lemsip. So you have here phenylephrine, which is again a decongestant. So it's something that you can buy over the counter, but you have to be careful. With high blood pressure and controlled high blood pressure, you're best avoiding this. You could get away with it if your blood pressure is well controlled, but again, it's another one. It's not as potent as the pseudoephedrine, which you can buy over the counter, but it works the same way. It's a decongestant, constricts your blood vessels, opens your airways, raises your heart, makes you feel better. You know, you it's close to amphetamine. That's a way to remember it. Yeah. Okay, don't misuse, please.
What else is
because
that?
in the past, people have been known to use it for slimming.
I was going to say about slimming.
Abuse it.
That's
Misuse it for slimming.
That's what I was going to mention.
Yes, for slimming. Yeah,
but
for slimming.
For
losing weight because it's burning you up. It's adrenaline.
Yeah.
It's you're ready to you're burning your fat stores into glucose. You're ready to fight. Yeah. But really, you're not going to lose weight using that. We've got better things for that. Okay. What else?
I was going to ask what else is in this one. Oh, so it's just paracetamol.
Just paracetamol, So there's nothing else in that. Paracetamol and phenylephrine. So a decongestant with that. If you look at Beecham's, I've seen Beecham's here. This Beecham's has aspirin.
Yes.
So a good old painkiller, anti-inflammatory. But we really are not in favor of aspirin these days. Aspirin, ibuprofen, because of their effect on the stomach. They thin the mucus lining of your stomach, exposing you to your own acid, and you can end up with ulcers. So, but short-term use you can do, no problem. Not more than 3 days. Yes, take with food, a bit of food. Now, I think this is related. Okay, So we also have nasal decongestants, which are quite effective fast. So they contain things like oxymetallazone and xylometallazone. So they are similar, as you can hear. And they're the only 2 ingredients. You can get ephedrine behind the counter, but we rarely ever sell it. There's ephedrine as well. But these are very good, but please, they only use for short-term use only. Why? Do you know?
No, I was saying I know about the steroid nasal sprays that we've got that can cause a rebound effect, but I don't know, is it similar with that or? Yes.
So these ones can cause rhinitis. I can't remember the name now. I think it's called rhinitis medicamentosa.
Okay.
Yes,
that
I've got
like
a friend.
spell.
You know my friend Leonard.
Yeah.
Yeah. You should hear him describe that. Yeah. So these ones here again work. They're sympathomimetics.
That's a mouthful as well.
Oh, sorry. Yeah, I shouldn't be using that word. They're decongestants, like pseudoephedrine, sort of same family. So they constrict the blood vessels, and they're doing it locally. Yeah, they're doing it straight away. But the problem is, if you're using for more than 7 days, you get a rebound.
Yeah.
You are constricting these blood vessels, then for a long time, all of a sudden you stop. Boom, they dilate even more.
Right.
So you can't get off it. You're using one after another, because once you stop it, you're getting congestion again. So really use 5 days, 7 days, stop. Don't use for longer. I was watching It's a documentary about a young man who was abusing young women, but he was addicted to this.
Yeah,
in Manchester.
Seeing that. Yeah.
Yes,
I saw. He had
loads of bottles of Sinex. Yeah, he had loads of. I'm talking about bin liners. So he must have got some addiction to it.
Yeah.
Yeah, and remember, because it's very close. These things chemically are close to amphetamine.
Yeah.
Was it giving him a bit of a high from that?
Yeah.
We don't know, but he was in trouble with that. And I wondered, in prison, how is he going to recover from the Remedies medicamentosa? Because that rebound would have been so bad congestion for him. So please, only short-term use only. Right. So what else? Have we covered everything?
Well, because I mentioned as well about steroid nasal sprays. Sometimes I know people come in. A lot of them that we've got as well might be targeted towards allergy. Like the fluticasons and things.
But not to use for colds and flus, because anything with a steroid is a higher, antihistamines, they're just breaking the first initial response to the foreign body. But these ones here suppress your immunity, your white blood cells. So you don't want to use that when you're having a bad cold, because then the virus can proliferate even faster, even further. So not to be used for that sort of thing. Yes, if you got your rhinitis due to some allergies, you can use that, but not for colds and flu. So don't use steroid inhalers for that. Okay. Again, I think we've covered everything, because all these here are the same things. They will still have a decongestant, maybe paracetamol or ibuprofen.
Yes.
Okay, but they cover all the symptoms. I think we've covered everything.
One
Anything
thing
that we've missed.
bring these tablets, but we've not really gone on sore throats.
Sore throat, but we can cover that separately.
In fact, nasal sprays as well.
Yeah, nasal spray. This is just normal saline.
Yeah.
And what normal saline means is the osmotic pressure in there. So if you were to put it against your blood, nothing moves out, nothing moves into the other. Okay, so it's the same. So even a baby could use, because we can't do them any harm with this, because the osmolarity is the same, but it's just to rinse the sinuses. I was once duped into rinsing my sinuses with soap. And I'm supposed to be a pharmacist. You think I would know?
You think so?
Whoa, the irritation.
Yeah.
My goodness.
Don't do that.
And someone was laughing at me for that. So don't do it. That's it really. I think we can wrap it up. Any other questions?
Well, one thing, I did bring two different options, because we've already spoke about pseudoephedrine.
Yes.
And a popular brand for the tablet form is Sudafed.
Okay,
which I did bring. I think it's a blue box.
Yes.
Yeah. And then there's this one here, which is just labelled as decongestant tablets. But I know
it's got the same ingredient. Yes, that's the thing. Again, this is we will do a special episode, I think, on brands and generics. What is the difference? Really, this is exactly the same, same dose, just different manufacturer. And sometimes the generic is actually manufactured by the same people who are making the brand. Yes. But somebody will say this works better, and they're prepared to pay £3 more than the other one.
Yeah.
Okay.
That will lead us nicely on to then.
Yeah.
We've got the same thing going on here.
Yes.
Difflam spray, benzdiamine.
Yes. Yeah.
Same ingredient, different manufacturers.
Different manufacturers. Again, this is for your sore throats. It's supposed to be anti-inflammatory.
Yes.
Yeah. So, and sort of coats again your throat, so that there's no ulceration there. A favorite for many, but if you ask me, I usually go for this one. I like the Covonia sore throat. It's got an anesthetic, and it's got chlorhexidine, which can stop any secondary bacterial infection. Because we know these coughs and colds, like say, they're viruses. Viruses, there's not much we can do to them. They come and invade our body, and so they are much more difficult to kill. Whereas bacteria are so different to our own cells. So there are so many points at which we can attack that. I mean, we can do another episode for that. I digress. But yeah, I like this one. It's got an anesthetic, and it's got chlorhexidine. Even better, I like the tablet form because of the longer contact time. So instead of just spraying it, which is very quick, but the effect dissipates as quickly. Whereas if you've got a lozenge with an anesthetic, it stays for longer.
Yes.
and
So
the anti
you keep it in your mouth for longer.
For longer, yeah. So it's acting for longer. The contact time is longer. What advice do you give for people taking anesthetics in the mouth?
So anesthetic is something that helps to numb. So I always say watch out if you're eating or drinking anything hot.
Yeah.
Because you might not be as sensitive to your mouth or throat burning.
Good. Okay. To me, that's a wrap. Unless you put any other questions. These things here, we've covered them already.
Yeah.
Obus oil, vapor rub. These are all counter irritants.
Mm-hmm.
I can, inhalation, putting on the chest, wherever you put them. But what we're trying to do is to encourage the loosening of mucus.
Same for the nasal stick because that's menthol.
Yes.
Same thing with the levo menthol.
Yes. Yeah.
Any kind of soothing throat things, just increase saliva.
Increase saliva, yes, counter irritants. Like I say, they're counter irritants. So we're irritating so that the body actually produces sort of more saliva or loosen. It's trying to produce more mucus, so it's loose, and then you can and it causes the lining of the larynx as well. Yeah. So it suppresses the sensitivity to irritants, which triggers the cough. So yeah. That way. Okay.
Sorry, just 2 more things I need to touch on. I've just noticed them at the front here.
Yeah.
In fact, 3 then.
3 things, okay.
I think we will have touched on them. It just depends on the ingredients. Paracetamol, guaifenesin, and phenylephrine.
Yes, so that's a good one. A good combination. It's got, so this will be good for mucus.
Yes,
it's got guaifenesin, which is expectorant. Encourages the mucus to come out. It's got phenylephrine, which is a decongestant, not as good as pseudoephedrine. But good, still the same. Constricts your blood vessels, opens up the airways, and of course you've got paracetamol to reduce temperature or reduce pain as well if pain is a problem.
So I know they used to do a liquid version of that to match this one, and it was blue.
Yeah. But this we've already covered. It's got tripolidine, which is again an antihistamine, and pseudoephedrine, a super decongestant. Over the counter. I mean, I say super compared to phenylephrine. Some people still argue that decongestant is not as much, but people will take them if only to make them feel better. You'll feel brighter, definitely. Yeah. We don't want to take the decongestants toward night because you might have problems sleeping. And then last one. Day nurse. Yes. So day nurse again has pseudoephedrine, which is the decongestant. I think your ears are ringing now. So again, it's a decongestant, a good one, and with paracetamol. So if you take this during the day and then your night nurse at night, you're sorted.
There we go.
Okay.
Sounds like a wrap.
We call it a wrap. Cheers. Thank you.
Bye.